Hello everyone, thank you for watching my videos. Again, this video will be about um, physio interview questions for band 5 um, in the topic of orthopedic and trauma. Um, and maybe you can use this as well for band 6 interview questions. Again, they would like you to answer questions in a systematic way. Let the interviewer know what you're thinking, and then say what your action plan is or what your intervention and your expected outcome or plan. Okay? For trauma and orthopedic questions, it can play around a variety of clinical questions regarding assessment, treatment, and holistic management, caseload management, clinical pathways and guidelines, and MDT. Thinking that this is more on acute setting. First question: a 45-year-old man involved in a road traffic accident. He has a fracture dislocation of his sacroiliac joint and a pubic symphysis fracture. He had 2 percutaneous screws put in his right sacroiliac joint and an ORIF to his pubic symphysis 3 days ago. First question is, there are no post-op instructions. What information do you need to find out, and how would you do this? Second part is, you have been told that he is bilaterally non-weight bearing for 6 to 8 weeks from pelvis point of view. He also has a right open tibiofibular fracture that has external fixature and has also had a skin flap under the plastic surgeons. Post-op instructions for this injury states he can weight bear as tolerated. Question is, what would you be assessing and what is your treatment plan? And what other professionals might you need to get involved? Second question: 75-year-old lady, day 1, post left hemiarthroplasty for a fractured neck femur. Talk about your initial assessment. And second part is, when you stand up, she begins to look pale and clammy and reports dizziness. What would you do? Next question: 25-year-old male, post-op day surgery elective ACL repair following a football injury. How would you manage this patient? Next question: a 60-year-old alcoholic male has fallen down the stairs and sustained a stable C6 fracture. He must wear a Miami J collar for at least 6 weeks. However, his compliance wearing the collar is poor. Question: how would you go about managing this man safely and on the ward and then for discharge? Second part is, he also has a right-sided pelvic fracture that is to be partially weight-bearing for 6 weeks. You have given him a frame to assist his mobility. You see a healthcare assistant on the ward mobilizing the patient to the bathroom with his Miami J collar on the back to front and full weight bearing without frame. What would you do? Next question: what do you understand about rehabilitation prescriptions? Next: 57-year-old female who has fallen from a ladder and sustained fractures to her right 3rd to 10th ribs with multiple flail segments. She is usually fit and well, but is a very heavy smoker and has recently been on antibiotics for chest infection. First, what would you include on your initial objective assessment? And then what would be your treatment? Next question: you have a 27-year-old male with an open tibial fracture that has a temporary external fixature in situ and a special plastic pump on the wound. He is awaiting definitive surgery. You know that the weekend physios has mobilized the patient non-weight bearing with crutches and told him to continue this independently while he waits for surgery. He noticed that he is staying in bed all the time, asking for urine bottles and bedpans from the nurses. How would you address this? Next, 41-year-old lady hit by a car has sustained severely comminuted open distal femoral fracture. Surgeons initially attempted limb salvage but decided that the above knee amputation is the only option. You speak to the patient prior to the amputation. What information do you give here? And what would be your initial treatment? That's all for these questions. Hope that will help you. For answers that will be available for those who are CSP, availing the CSP mentoring scheme, just look for my name and maybe we can work together on your next interview and successful search for the job you wanted. See you in the next video.